must confirm I am over 18 and consent to this video.
So my name is Nicole. I'm going to be your nurse for today. Can I please have your name and date of birth for verification?
Parkerson 042398.
Okay. And today I'm going to be doing a head-to-toe assessment. Do you have any questions before we begin?
No.
Okay. Would perform hand hygiene. I don't have any Purell on me right now. But okay. Can you please tell me where you are and what the year is?
Doctor's office in the year 2020.
Okay. Based on the patient's conversation, he is alert and oriented to time and place. And based off our conversation, his hearing is grossly intact and his speech is clear and articulate. So I'm now going to begin the physical assessment. So starting with the head, it is firm and round. Looking at the scalp, it is clean and intact with no signs of lesions. Okay. Temporal pulses are 2+ bilaterally. The ears are in line with the eyes. Do you have any pain or tenderness? There's no signs of lesions or masses. The eyebrows as well as the eyelashes are full and symmetric, and the eyelids are symmetric. There's no signs of drooping. The sclera are white. I'm just going to pull down here. The conjunctiva are pink and moist. I'm just going to ask you to stare forward. Stare forward, please. Pupils are equal and round, and they constrict to light. Can you stare out? And then at my finger. Okay. Pupils are accommodating. Now can you just stare at the pen and just move your eyes? That's good parallel tracking. Can you breathe out of this nostril? And this one. Good. Can you smile for me? Puff out your cheeks. Squint your eyes. Good. Facial movements are symmetric. Can you open your mouth for me? All of the teeth are present and intact, but they are in good condition. The hygiene of the mouth seems to be good. The mucosa are pink and moist, and there's no signs of an odor. You can close your mouth to me now. Okay, I'm going to feel for your lymph nodes, and let me know if you have any pain or tenderness, okay? This way? This way? Any pain or tenderness? Okay, the lymph nodes are not palpable. I'm now going to feel your trachea. Trachea is midline and palpable. Carotid pulses are 2+ bilaterally, and I'm going to listen for bruits. Take a deep breath and hold it. Okay, relax. Take another deep breath. Hold it. Okay, good. Relax. I'm now going to feel your chest. Let me know if you have any pain or tenderness. Any pain or tenderness?
Mm-hmm.
Okay, his spine is straight. His AP ratio is 2:1. And right now there's no apparent lifts, heaves, or thrills. And looking at him, he doesn't appear to be in any respiratory distress, and his breaths are even and unlabored. That's good. Going to feel for your rib cage. Your rib angle is less than 45 degrees, and your CV angle is less than 90 degrees, which is good. Now I'm just going to listen to your lungs. So just take a couple of deep breaths from me, okay? Okay, now I'm just going to listen to your heart. Now I'm going to stay here for 1 full minute. I'm not actually going to, and right now I can tell that your heart rate is 70 beats per minute and respiratory rate is 13 breaths per minute. And now I'm going to switch this back and listen for any murmurs in your heart. Okay. Can you turn around for me, please? Sit. Just no, sit like works. Now I'm going to listen to lung sounds in your back. Can you lift your arms up for me? Just leave them at your side. Good. You put your arms down. And I'm going to check for lung expansions. Just take a deep breath. You have equal lung expansion. Okay, turn around. And now I'm just going to check your arms for and skin, make sure everything's good. The skin is an appropriate color for your race. You have pink undertones. Hair seems to be equally distributed. There's no signs of edema or lesions. Now I'm going to feel for your temperature. It's equal all the way down. Radial pulse is 2+ bilaterally. It's elastic skin turgor. Capillary refill is less than 2 seconds. The nails are clean and intact and appear to be at a 160-degree angle. We're just going to check for clubbing, so you can just do this with your fingers. Okay, and there's no signs of clubbing. Can you grab my fingers? It's equal grip bilaterally. Okay, and I'm just going to have you lay down for me. Lay down this way, please. Thank you. I'm going to ask you to turn your head this way. Okay, and then the other way. And I can see the jugular vein, but there's no sign of distension. And now I'm just going to lift your shirt up. I'm looking for any visible pulsations or asymmetry, and I don't see any. So now I'm going to auscultate your stomach. Do you have any pain or tenderness in your stomach before I start? Okay. And now I'm just going to listen for bruits. See it active bowel sounds in all 4 quadrants and no signs of bruits. So now I'm just going to press into your stomach and let me know if you have any pain or tenderness. Any pain or tenderness? No? Okay, now I'm going to do a deep palpation. Any pain or tenderness? No? Okay. I'm now going to move on to the lower half of his body. His leg hair appears to be symmetric, and again, the skin tone is appropriate for his race. There's no lesions or anything. The skin's intact. Temperature is the same all throughout. Can you just move this side? Thank you. Okay. And now I'm going to feel for the dorsal pedis. That's 2+ bilaterally. Sorry, this was the posterior tibial. This is the dorsal pedis. And that's also 2+ bilaterally. Capillary refill in the toe is less than 2 seconds. Can you close your eyes? You feel anything?
Mm-hmm.
Okay. Anything? Okay. I'm just going to ask you to relax your leg and let me know if you have any pain.
Mm-hmm.
No? Okay. And the same thing on this leg. Just relax it. Any pain?
Mm-hmm.
No? Okay, good. Can you stand up for me? Can you place your feet together? Close your eyes. Okay, can you open your eyes again? It's a negative Romberg test. I'm going to ask you to walk this way. And I'm just going to look at your gait. Good. Turn back around. Looks good. Can you walk on your heels toe? Okay, and back. That's good. And then can you just walk on your tippy toes? It's good. Now we're just going to do some range of motion. So can you put your, just follow me, put your chin to your chest. Back up. Turn your head to the left and to the right. Circle back and the other way. Good. Shoulders and this way. Put your arms above your head and behind your back. Twist this way and the other way. Good. Switch elbows. So I'm just moving so I don't hit you.
Sorry.
Wrist. Hands. Good. Touch your fingers to your thumb. Good. Can you bend down, touch toes? Good. Stand back up, lean back. Good. Can you stick your one foot out straight by your ankle? Good. The other leg. Good. Do a shallow squat. Good. Okay. That's it.